All right, well, welcome, everybody. Because I think coming to a session at 4 o'clock on Friday is probably one of the hardest things to do. So I brought some chocolate that my lovely assistant here, please help yourself, and maybe that will make the hour go a little bit easier on everybody, including your presenter. So I guess, and I don't know if I have to tell you this, but we are being live streamed, so and they'll upload this later to the website. So in your questions and things, just be, I guess, mindful of that. Just kind of an editorial comment. So this is my topic that was given to me. And quite honestly, if I was honest with everyone, I don't even understand the topic, okay? So I'm going to try to do my best here, though, and sort of interpreting it as we kind of go through things. But it's a little bit awkward, but I'm going to try to kind of, I hope, hit sort of the highlights. And really, I'm hoping that, especially since we have a nice smaller group here, that folks will please chime in as you have any particular thoughts, questions, criticisms, whatever you like, would really, I think, be helpful. So I'm supposed to say who I am. So I'm Amy Cheshire. I'm a clinical social worker and researcher at Rochester, New York, at the University of Rochester. We've been a center of excellence. We were one of the original ones, actually, back in 2000. We've been taking care of Huntington's families actually since the late 1960s. Marjorie Guthrie, who folks heard about this morning, really reached out to our initial director, Dr. Ira Byock, back in the early 70s, saying, you need to do something to help Huntington's families. So we've been seeing generation after generation of folks. So that's just a little bit about me. These are just nobody is supporting me, so we don't have to worry about any conflicts. So who are these people? They're my parents. So that's my mom and dad. And my dad unfortunately lost his battle to Parkinson's disease earlier this year. And the reason I show this is this saying, which is actually, home is what catches you when we fall. And we all tend to fall. This actually is a saying from a well-known president. If anybody wants to make a stab at who this might have come from, any ideas? Reagan! How did you know that? Okay. Wow, if I had a prize, I would give it to you. But so he said this about even, I think, in his days in the White House, that it always meant a lot to him as he was kind of coming home to know that there was somebody on the other side of the door that was hopefully kind of waiting to hear his footsteps, knowing that home was really a place that you could really fall and be yourself all at the same time. So I think it's just kind of an underlying theme of what I'm talking about today. So not to get all into theory a lot, but of course, as I'm a family therapist by training, so Dr. Bowen, who did a lot of the early work around family systems, this is just a quick little reminder of what the family life cycle typically is. I don't think this has shifted a whole lot through the years, but you can see here kind of the common steps that most families will kind of go through at any given point. I don't think there's anything unusual or that's totally changed a lot about this. Maybe the time and the ages that people are doing these things have changed through the generations, but essentially these are kind of the common sort of family sort of life cycle that goes on. So that's a normal life cycle, right? And then this is kind of what happens when HD enters into the picture. And again, whether this is through genetic testing or by someone just getting a clinical diagnosis of Huntington's is obviously a huge, and I probably should have highlighted that word, that really tends to unstabilize the system pretty dramatically and can really cause this, what we call disequilibrium that tends to then kind of be a fallout at times for families. So these are just some general things about families. And in particular, I like this idea about most anthropologists agree that next to kind of the peculiar tendency to think and use tools, one of the really distinguishing characteristics for human beings is that we really are, no surprise, social creatures, right? The social group is really tends to be one of the primary shapers of human behavior. So good, bad, or otherwise, the family is really still pretty much the primary unit that kind of really helps shape our behaviors as we age and get older. And I think for Huntington's families, obviously this whole concept really resonates in a lot of different ways, hence why this topic about talking to adults about Huntington's disease is really a kind of critical piece of things. The other thing I think that's nice about this is thinking about families in some ways like, do people know what mobiles are, right? So as sort of one piece of a mobile moves, the rest of the system often moves at the same time. And this is a lot of the kind of dance or sort of interchange that's often happening within an HD family. And the other big thing that we talk a lot about, but it really affects the entire system. It's really hard to think that would be otherwise just because of the disease, but obviously because of the genetics of HD as well. All right, so, all right. I don't know if people are familiar with this concept. It's a little bit older in some ways if you've been around Huntington's a while, but we don't talk as much about it, but it's still sort of this phenomenon of what we call pre-selection. And again, this tends to be pretty subconscious, so it's not like something that families are typically maybe even totally aware of, but there's a sense of, there's kind of this class, what they say classification up here. In other words, thinking, well, I know my son probably has the gene, right? He's acting a certain way, he's maybe getting into trouble, maybe he's having a hard time at school, so we really think he's the one that's going to get it, right? So there's this often kind of what we call sort of selection that can go on. Sometimes it is much more conscious, but a lot of times it's much more on the subconscious level. And the issue with that is then that often children then start to fall into that same type of thinking that's going on. And so that's why we try to kind of just be aware of, and this seems to be really a way for families to cope, quite honestly. So it's not necessarily that it's a bad thing, there's nothing bad about it, but it's just a way often for families to there's so much stress and anxiety that goes along with growing up, or certainly being aware of Huntington's in your family, that this is seen as often just a way to kind of help sort of contain or sort of kind of help manage that level of kind of anxiety and stress. And this doesn't go on in every family, but just to point out kind of, one of the more kind of peculiar things that happens. The other big thing, and people may want to debate about this a little bit, but these are often kind of one of the two kind of, at least initial, but even as Huntington's is sort of moving along, common kind of ways or strategies that folks can deal with Huntington's within a family. So the first one is certainly avoidance, right? And the second one is about denial, right? And years ago, I used to work with a geriatric psychiatrist, and he used to tell me that denial, Amy, isn't really always a bad thing, right? Denial gets sort of a bad rap, right? But in many ways, denial helps as a way, it's kind of a buffer to kind of deal with what's going on. And so for many people, having these kind of feelings or staying in some level of either avoidance or denial, it isn't necessarily always a bad thing. It can become more problematic, I guess, if over time, when a level of denial starts to create, some real difficulties, in particular, obviously, for the person that has Huntington's disease. But in terms of a coping kind of mechanism for families, I just wanted to kind of share that it's not always as bad as you may think. And when I hear from families, things like, well, if he would only accept this, or if they would only recognize that, they shouldn't be doing this, any of those kind of things kind of help speak to that idea that keeping in mind sometimes people really need that in order to kind of just keep coping with some of the day-to-day realities, and that it's not all bad, and that may be a good thing. So what do we kind of know? The whole point of this kind of session today is to talk about, how to communicate about Huntington's disease to adults. And I just wanted to highlight a number of things that obviously I think we're preaching to the choir here in terms of families with HD face a lot of challenges. But it's also dealing with challenges in the present, right? In the current generation, what's going on in the here and now. But for HD families, also then thinking about future risks and what's going to happen for future generations. So it's really that kind of double whammy that we often don't see in other kind of diseases or neurological diseases in particular, that I think often can kind of raise the bar and often create even some more challenges for some of our Huntington's families. And the whole issue about genetic testing, and I know there's a lot of the sessions going on here today that talk about a lot of the implications of going through genetic testing and how to tell families or not tell families. Some of the things that we tend to see, at least kind of from a literature perspective, is that sort of delaying or sort of not always disclosing about when a new test result, let's say, has come about that's positive for HD. It often kind of makes families often less sort of what we call in family therapy cohesive, that often that can kind of contribute, and it's sort of like a little crack, if you will, in sort of the family armor. And so often that creates conflicts for families. And families really struggle then to find, again, that kind of balance to get hopefully a little bit back in check and things to be going better. And really finding ways, which is part of why folks are probably here today, finding ways to help adult children really manage the knowledge about Huntington's disease, and to really try to help sort of prevent it from really sort of taking over, if you will. I know in our program, in our clinic, one of the things that I often talk about with families, in particular when someone has gone through testing, let's say, or even gotten newly clinically diagnosed, is that you often are sitting there in our clinic, or you leave the clinic, and you sort of, if you think about your life as like this large plate, people at that moment often really feel like that entire plate right now is all about Huntington's disease, right? And so our hope with people as time goes along is actually that that piece of Huntington's should get smaller on the plate and not continue to get bigger and bigger. We know when things continue to feel like they're getting bigger and bigger that people are probably really struggling. And whether that's struggling with depression or anxiety or hopelessness. But our goal is really to help people navigate those waters so that their life feels, you're not Huntington's disease, right? It's a lot of those kind of daily, helping people with those kind of daily reminders about that, because it's really easy to fall into it. And a lot of times folks feel like this, right? That you sort of feeling like you're in limbo. And a lot of times just feeling, part of that is just really not knowing sort of, how do I get out of this? What do I do with all of these kind of feelings and things that are going on? And having that sense of being stuck, right? So I thought it would be helpful to actually talk right off the bat about what doesn't seem to work, okay? This is a little, usually most social workers try to focus on the strengths, and we'll definitely get to that. But to be realistic, about this is just from practice, okay? And I think in particular, the first one there is probably the most critical one. Not talking about it. That's probably one of the top things that we encourage people not to be doing. Is that for the most part really finding a way to find the dialogue, to find the opportunity. The more talking about things, again, tends to bring down that stress, bring down the anxiety, really try to increase in terms of quality of life, again, from a family perspective. The other thing is, what I often hear, in particular, when someone's maybe newly diagnosed in an HD family, maybe first person, then they have to go around and tell adult children maybe, tell other people in the family. And a lot of times what I hear is, well, we need to wait, right? Because somebody's going to have a graduation, then there's somebody's wedding that's coming up, then there's some baptismal that's happening, and then we're going on vacation for a few weeks. And you know what all that is, right? What? Excuses, yeah. We have a saying, if you want to do something, you will. If you don't, you'll find an excuse, right? Again, the bottom line with that is, guess what? There's never a right time, okay? And if you wait long enough, you shall never find the right time. And I think as much as we'd like to think otherwise, I think the reality is there really isn't a right time for any of this, okay? There's the best time for you and your family, but to take some of that pressure off and belief that there's going to be some right time, because the reality is there just really isn't, okay? Does anyone feel differently about that? Or, okay. So some other thoughts. I think this is important. Thinking about talking or telling to families, it's not really a single act, and I really try people or encourage people to think about it more as a process. I don't really tend to use that word process, but, and you don't want to make a big deal out of things, right, as much as possible. Trying to kind of normalize. You don't want to have like some big serious discussion. That often just, guess what, increases everybody's, anxiety. So trying to normalize the process or when you're going to talk to people, again, can just help lessen some of the anxiety. But not to think of it as like a one-time kind of deal. Probably most people don't, but to really think about it more as sort of a process and not just a kind of one-stop thing. The other thing in terms of, I know I'm not focused on kids, but even young adults, is being mindful of too much information all at one time. It's super easy for people to get overloaded, especially younger children, or not even that young of children, but just being mindful of how much information somebody is really ready to receive, wants to receive, and you really have to be able to kind of pick up on family members' cues about that, but just being mindful about too much information all at once is pretty tough to take. So I'll move through some other things on here just to interest of time, just a quote about grief, because if there's any question in the room about why is this all so hard to do and what's kind of the underlying current, it's really grief. And that is going on in kind of all of these kind of processes, whether you realize it or not. So to really try to help, there isn't a lot of information kind of actually in the literature about this kind of topic sort of broadly. So I tried to drill it down to some common situations that hopefully people can maybe relate to, and talk about some of my own patients and their experiences in kind of dealing with this, and hopefully people can kind of relate to it. These are common, what we call family scripts. So what's a family script? That's a way, again, whether families consciously, more subconsciously, learn how do we do things in this family. And often, guess what? With Huntington's disease, you learn how Huntington's disease is done in your family, okay? People often don't think of it so much in those terms, but that's kind of the reality. It's often a common question that we ask when patients kind of are first come into the clinic, you know, how would you talk about Huntington's in your family? You know, what was your first experience? When did you first hear the word Huntington's disease? Did you hear it? You know, those kind of things. So these are kind of some common family scripts. There are more, but I just wanted to kind of hit the highlights, right? So there are families certainly, and if people are maybe comfortable even kind of raising their hand about if your family falls into any of these categories, that would be great. So the first one is having always been told. So is there anyone that kind of grew up in a family, always knew about HD? Okay, just one. Wow, interesting. Okay. Any in terms of sort of gradually told, meaning that information was kind of what I use, dripped out. Okay, so a few more. Okay. And then HD was kept a secret. Anybody where it really, okay, gentlemen in the back. I feel like I'm running an auction. Okay. HD was kept, no more than that, huh? Only person, that's interesting. Okay, and how about HD as a brand new diagnosis in the family? Okay, oh, interesting. All right, so I'm going to walk through each of these a little bit more, and hopefully we can talk about them. So this is actually one of my patients. And yes, she's almost 8 months pregnant in that picture, if you're wondering. And so I'm going to call her Susan, and hopefully I will remember that to protect her confidentiality here. Well, she's very aware that we're sharing her information and glad to do it. Susan grew up in a family where actually her mother was one of my first patients. And her mother knew that her mother had Huntington's disease and her grandmother had Huntington's disease. So the family was very familiar with Huntington's disease. And when Susan's mother was initial patient, she actually used to bring young Susan to the clinic appointments. And she always wanted her daughter, she had a couple of concerns there, but she always wanted to be able to talk about Huntington's so that it wasn't a scary experience for her daughter, and it wasn't anything that should be seen as shameful or anything that she should be afraid of. And she used to write these lovely letters to her daughter when she was still quite well. And we kept a lot of those in the clinic. And it was really her hope, certainly, that her daughter wouldn't get Huntington's disease, but more importantly, that her daughter could really watch her mom go through Huntington's disease and still really be able to talk about it and keep the family, even though she became a single mother pretty rapidly after being diagnosed. It was really kind of a testament to her mom. And so this is Susan, obviously at her wedding date. And a number of years ago, she decided to go through pre-symptomatic testing. And as you might tell, these are her various friends that have all gotten these tattoos on various parts of their bodies because Susan did test positive for the HD gene. And but she's always, she's gone on and obviously had gotten married, has had 2 young children. And I think really it's been interesting, obviously, to see her now as a young adult and going through this. And I think she's gotten a sense of hopefully her mother really carried the mantle in terms of how do we do Huntington's in this family. She got a lot of good scripting, I would say, for it. And she's really taken with that in terms of building awareness, getting her network together, and that kind of thing. So I think in terms of her situation, this may not always be the case, but where HD was always known, that it really has probably helped her in kind of her own journey, if you will, with Huntington's. So the next one is really finding out what I call in drips, okay? And I know there were a couple of folks in the audience that could kind of relate to that. And so this is another patient, gentleman on the right, who I'll call Bob, and his wife. And he really grew up in a family where there was some acknowledgement that there was something wrong with his mom, and there was a little bit of talk about it. This would have been quite a couple decades ago, right? And they just, they called it the dance in their family. And that a number of family members had this quote-unquote dance. There was also a lot of alcoholism that went on in the family at the same time. So that often kind of got mixed in there too. But there was always a sense that there's something a little bit different about the family. And so as time kind of went on, and as everyone was getting a little bit older, then there started to be more specific information. But it really wasn't until Bob, my patient here, was really more into his early 20s, and when his mother got diagnosed with Huntington's disease, that the drips really started to open up, right? And they weren't drips anymore. The whole fire hose was now going. But in the early days, it was more that kind of drip, a little bit of information. And then as more people were getting diagnosed within the family, more and more information was forthcoming. And so Bob is another one who waited, never wanted to go through testing, and really held on as long as he could until he kind of couldn't ride his motorcycle any longer, and opted then, he really finally got a clinical diagnosis of Huntington's. And so this is his wife, and then they have 4 children. And those children all have children as well. And so what's been interesting is that they have struggled, I have to say, even though there was some of this dripping of information, even into this current generation, Huntington's disease is still seen as a little bit of a challenge in terms of talking about. Some of the family members, about half the kids have gone through have opted to go through genetic testing. The other 2 haven't. So it's been interesting to see their journey is a little bit different in some ways because they got some information, but there's still a little bit of, I would say, hesitancy or sort of lack of information to some degree that goes on with this family. The other one, and it's interesting to see such a small show of hands for this in terms of what I call HD is kept quiet or kept a secret. I don't really like that term too much, but that it's really something that wasn't talked about. I think this has gotten better, and obviously kind of by the show of hands, it's encouraging. I know in the early days of working in Huntington's clinical work as well as research, this was pretty common, right? That we either didn't talk about it, we didn't know how to talk about it, or people were just kind of shut down from any kind of conversation. And I do hope that all the efforts of many decades of HDSA's work has changed this, but it still does exist. This is just a family picture. The bride here, Dorothy, at the time had no idea that her mother, who's right on her right, had the gene for Huntington's disease and was starting to show some symptoms way back then, but nobody talked about things. And it really wasn't until, this is Dorothy now sitting in that Adirondack chair, and she got diagnosed as the first person in the family then at age 68, right? So these are her 4 adult children in the background. And really then, of course, when people get diagnosed so late in life, what happens is there's been so many generations. Obviously, her children had all gone on to have their own children, and those children had gone on to have those children. And so this really created quite an issue in the family. And when Dorothy was first diagnosed, many people really had a hard time. We just got flooded, right, with calls from the entire family, which was all over the country, wanting to know what was this about. More importantly, what could they do at this point, whether they should get tested, and all those kind of things. So it was sort of like a tsunami, of HD, because it was really something that was never talked about at all in the family. And the other one is, and a number of people here, I think the most people raise their hands actually about falling in this category. So new HD diagnosis in the family. And this gentleman on the right is a beloved HD person in the Rochester community. He was actually on the Rochester Police Department, and he was a detective, and started having more difficulty. He'd have to go to court to testify, started having more difficulty being able to do that. Had no idea why this was having a harder time passing his shooting, getting his pistol. All right, talk fast? Okay. Before the next alarm, yeah. Anyways, so Bill, and this is his wife, Molly, in this picture, just didn't know what in the world was going on. And so he came into our movement clinic, not our Huntington's clinic, came into the movement clinic and went through a really exhaustive evaluation because, of course, nobody's looking for Huntington's disease. And it was really almost by accident in some ways that finally, because we just couldn't figure out what was causing these changes for Bill, who's quite a character. He's an Irishman by background. And he was getting very frustrated, as was his wife, because meanwhile, he was continuing to struggle to be a police detective. And so actually, I think out of some degree of desperation or frustration on our neurologist's part, we said, well, we'll just run, this thing called the Huntington's gene test, really just to totally cross this off as this absolutely is probably not what's going on. And of course, you can guess how that story went. So it came back that Bill did carry the gene. They had absolutely no idea what Huntington's was about at all. And I think in hindsight, and people can probably relate to this, probably what happened is that his dad died rather early, not super early, but I think around his late 40s. And so his dad is suspected probably as having died before he could start to show symptoms of Huntington's. When you go back and try to do those kind of family autopsies, as we call them, sometimes you can start to put the pieces together. But meanwhile, this was devastating, right? They also have 2 adult daughters who were both in high school at the time of the diagnosis or getting the gene test back. And what's interesting about this, and the reason I show these pictures, is that he really decided, people can respond in a lot of different ways, right, to this kind of, and there's no right or wrong way to do any of this, okay? But Bill decided I'm a known force in this community. He had to retire on disability from the police department after the gene test came back positive, and he just, obviously, it's a quite demanding job, wasn't able to be doing it, and decided then I'm going to do what I can, similar to the Johnson family story this morning, kind of reminded me. And so he started, you can see the t-shirt here, the Bill Lawler 5K walk and run, and it's been going on. We just had the 9th time this past May. It's usually the first weekend in May. And just a phenomenal event. And every year, Bill's been at the finish line and pretty much waves and high-fives everyone as they come across. I have to say, this year, when we're now 9 or 10, about almost 10 years into his HD, so he's still there, still able to high-fiving. He's been someone that's been blessed to be able to have a good response to some of the treatments to help lessen his movements. And so Bill keeps at it, and as does his family. So, but I think it really is a lot of what we call recalibration that has to happen when it really comes completely out of nowhere on families. And probably many of you can relate to that. So again, life can be difficult and quite unfair. Relationships, especially where Huntington's is concerned, really can challenge the best of families and the best of relationships. These are some simple phrases that people can think about that may help you. If people have ever heard of Dr. Ira Byock, he's actually a well-known end-of-life and palliative care or hospice care physician, and he's written a wonderful book, if you ever want to pick it up, called The 4 Things That Matter the Most. And he talks about his experience working with families that are dealing with the end of life, and really encouraging to think about using these 4 very simple phrases, but especially when you get in a bind, or you can practice this at home. I practice it on my, now 15-year-old, the idea of saying thank you a lot, which made him very suspicious. Okay. But I encourage you to think about, especially when you're stuck in a situation, that sometimes it doesn't have to be long explanations and a lot of gobbledygook, that sometimes just hitting at some of these things is all people need. So please forgive me, I forgive you, thank you, or I love you. And so these are just kind of 4 very simple phrases that often can help people and help families when they're going through everything related to HD. Just another little saying, don't confuse my bad days as a sign of weakness. They're actually the days I'm fighting my hardest. I think a lot of that goes on in HD families on a regular basis. So in the interest of time, I'm going to kind of move through. These are just some of the kind of typical kind of family dynamics or dyads, and to hit some of the highlights in terms of how does HD affect some of these folks. In particular, if we think about marriages and what are some of the issues that go into dealing with Huntington's. We know from our research that, again, if you really married into a family where you weren't aware of Huntington's disease, it obviously can make that road go a little bit more tricky for people than folks that knew somebody they were marrying that was at risk and might get Huntington's. That probably seems pretty obvious. There are some protective factors. Some of the things we've learned that's really actually a little bit interesting is really how people perceive their role in terms of being married to someone that has Huntington's disease goes a really long way in sort of how they manage the road ahead. It's not even as much sometimes about severity of someone's symptoms, but really how your perception, in other words, how you view your situation, good, bad, somewhere in the middle, really goes a long way in sort of how you may sort of manage over time. Since I won't get into, so we're not really talking too much about children, but in terms of some of the things that we know, about children and how to do in terms of parenting, I've just sort of kind of listed up here some of those highlights. I'm not going to spend too much time on that. But these principles actually, believe it or not, also apply to adults, okay? So again, some basic things. Truth is better than deceit. And honesty, of course, tends to foster trust and security. I ran into this, for example, with a gentleman with HD. He had a teenage son and a younger daughter. He had been diagnosed with Huntington's for a number of years, and he finally was kind of able to really talk to his son about it, and with a lot of encouragement. And so I asked him afterwards, well, how did it go? Because parents tend to get really worked up about this, right? They almost make it worse on themselves than they need to, but again, super common. And anyways, he came back and he's like, well, yeah, it went, pretty well. I told him, and then I told him that he wasn't going to get it. Right? I was like, oh my Lord. Okay, I'm clearly doing a bad job. Okay. And I was like, what? I think I tried to hold back a little bit, but he's like, I just couldn't bring myself to really explain about that he was at risk to get it. And so, it's one of those things again, where truth is always harder, but probably going to be better, because then there's a lot of sort of damage control that someone is going to have to do over time, right? So keep those things in mind. All right. Does anyone know what this is? A time bomb. Okay. Why would I have a picture of a time bomb in a Huntington's talk? Any ideas? Does anybody know what this might represent? A ticking bomb, right. But why would I have it in this talk? Time is running out. Okay, interesting. All right, I like it. Does anyone else have any? Why in the world did I just zone out and put this in my talk, or did you guys have any other ideas? If you don't deal with it, it's going to blow up. Right. Okay. Good. And you don't know how. Okay. Well, those were all good responses, but they're not the right ones. This is often how, guess what, people that are at risk feel. That my life is a ticking time bomb. And the time bomb is what? Will I get it? Right. Is Huntington's? Is it coming? Is it starting? Is the ticking getting louder? Is the ticking going away? Is the ticking getting so over the top that I have to come and do something about it, right? So this is a pretty common, well, somewhat common experience that folks that are living at risk, not everybody, but many people that are living at risk feel this way. This is an old quote from Dr. Randy Jones, who is a beloved neuropsychologist actually at Emory University in Atlanta, who wrote, if you've never seen, this is again an older book, but a great little ditty called Walking the Tightrope, that I think HDSA probably still has on their website. But I think this is a great quote, in particular the end of it. But being at risk is dying a little each time you drop a spoon. Being at risk is looking at your brothers and sisters, wondering which one will be the first to go. The constant pressure, day in, day out, year after year, takes a really heavy toll. I feel at times that being at risk has taken away my right to love and be loved. Right? So that really gets to kind of the heart of the at-risk experience. So, to try to kind of move this along and wrap things up, some lifelines and some thoughts. Again, and these are just Amy's thoughts, okay? And you can take with them what you like or don't like. You are, though, the HD expert in your family. okay? The more information that comes directly from you, and again, I highlighted directly, to other family members, which is what this whole talk is supposed to be about, the better everything is going to go, in particular compared to, quote-unquote, Dr. Google, all right? So what do I mean by that? Okay? That we had an experience, and I don't think they're in the room, so I won't embarrass anybody, but many years ago, I got a panicked call from a gentleman who was married to a young woman who had Huntington's disease. She was in her early 30s and pretty kind of early stages of Huntington's disease. She had 2 young daughters. Her daughter, who was in 3rd grade at the time, had just come home from health class, okay, and went on to come in, have some cookies or milk or something like they used to do in those days, and went on to tell her father, oh, I learned today that I'm going to get the same disease that my mom has. Oh, my Lord. She's 8 years old, right? He was on the phone to me in a heartbeat, in a huge panic, because he had no idea, he was not prepared for his 8-year-old daughter to now have this kind of genetic information, right? And he wanted a fix, okay? Does anybody have any ideas how you do that? The genie was out of the box, right? Dialogue, right, which is what, as any good social worker, I'm going to try to do, right? So I said, well, have her come in, you know? And so she comes in. This is all happening this whole same day, okay? Because there's a sense of urgency and mild panic going on. And so she comes into my office, and she's actually here today at the convention, now in her early 20s. And you know what was interesting about talking to her? Just like any kid has so much resilience, she was not impacted at that moment at all by knowing her at-risk status. She was only concerned about her mother, right? Her father was in a complete freak out mode, okay? But it was so humbling to see that this little 8-year-old who sat in my office, she's still a little tiny thing, and really was not fazed by this. She was just so focused on her mom, and is her mom going to stay around, and how long is mom going to be here, and those kind of things. So it's interesting to see just sort of how these different situations tend to play out in families that you sort of didn't anticipate always. So some other things to think about, but I think it speaks to the resilience, which is the thing that I always admire about Huntington's families, always talk about it. I think just stepping out of bed every day is your first act of courage, and then everyone that goes on beyond that is just more courage. But it's that sense of resilience. So trying to always keep that in mind. And how have you weathered other storms? Usually there are other things that have happened in your life that aren't just about Huntington's disease. And so families can often learn by, well, how did we manage this other situation, and to try to kind of draw from that. And one of our former chairman of the Department of Neurology had this last saying on here, so I sort of stole it from him. You know what, at the end of the day, you can't sort of always be right? But you can always be kind. And I think both to yourselves is super critical, but as well as your other family members, especially when it comes to Huntington's. These are some resources that are also part of the handout, so I won't go into a lot of those. And this is one of my favorite quotes by Ernest Hemingway. The world breaks everyone, and afterwards many are strong at the broken places. So I hope we all find our strength in our broken places as well. So I think that's a wrap for me. People probably want to run to the doors, but is there any questions before you do run out? Oh, I think you're supposed to, do I have to? They want you to, because it's being recorded, they'd like to know what you're saying.
So It's kind of a social worker to social worker question, but if you're working with a patient who learns that they are positive, but have decided not to tell their adult children, how actively do you encourage them to tell them, or?
Have you encountered this, I'm gathering?
Yes.
Okay, all right. You don't want to tell me how you dealt with it?
Well, mind you, I started my job 5 weeks ago.
Oh, okay. All right. So
I
you
don't know
have
what
all
I'm
that
doing.
experience.
But
Yes, that's hard.
I asked her questions about her reasoning, and
And what was her reasoning, did you feel like?
Well, it was some of what you said. One of the daughters was about to graduate.
Yeah.
She had some other things that she was busy with. It sounded like she had, her ex-husband had really wanted to know before they had kids, and I think maybe she hadn't been honest with him, so she was afraid that he would find out and be really angry at her. So she kind of said it was like for the girls' benefits or her adult children benefit, but it sounded like there was also an element of her being afraid. So
You mean it was to their benefit not to know?
Yeah.
Okay.
That she was doing it for them.
Okay.
So I just asked her some questions and just, said, well, as you continue to think about it, we have resources for you to help you with that discussion when you're ready. And then I followed up by email, and I sent them the HDSA, how to talk with children and young adults about HD.
Okay, yeah.
And she didn't respond.
She didn't, okay. Were you expecting a response? Or hoping for one? Okay. Yeah, I think it's a great point, right? And it's a hard situation. I think it is a process, and as much for us to think about that as well. The gentleman I talked about who finally told his son, but kind of didn't tell all the accurate information, it was probably a number of years before he even could talk to him about Huntington's disease. So some of it is letting go of our own timelines, I think, as providers is kind of important there. And that's all you can do is try to kind of understand a little bit more, what the rationale. It's usually we're trying to protect them. And we do have many people that never tell adult children for a long, long time. The thing that we know, though, from a family perspective is that genetic information like that then that isn't disclosed, as I talked about earlier, does a couple of things. It tends to keep people stuck badly. Okay, it tends to keep people on guard because oh my God, you don't want to inadvertently disclose it, and so knowing that can kind of be helpful in trying to talk to people about that. But for most folks, I think you have to kind of let it go, I'm afraid. It's probably one of the hardest lessons I've learned about Huntington's disease is that when I try to make things happen, it often is some of the best advice to let things go. So I know that's not a great answer, but
Almost sounds like she's still laying it down.
could be, yeah. And sometimes that's what I mean about a process, and sometimes people have to work through that, and that's fine. There's no right or wrong there, but yeah, it's a great question.
It goes back to denial and avoidance.
Yep, denial and avoidance, right? Any other last minute, or does anybody any thoughts about that? Were you going to say something?
I was just going to say that there were a couple things that struck me about your talk. I came in because it's not so much talking to adult children about Huntington's. My adult children have been talking to me.
Okay.
And I think you probably have encountered this as a social worker too. Very often you have people that have never tested or are really not interested in knowing.
Right.
But I have adult children now that are saying to me, well, we need to know, so you need to test. And that dynamic, which is kind of the opposite of what I was expecting when I walked in here. And the other thing too, I don't know if anybody else reacts this way, but when I see these generations of, I got the picture about the young woman who, they really didn't know what Huntington's was.
Right.
I've lived through so many generations of this disease now that truly, when my grandfather was diagnosed, he was never diagnosed because they didn't know what Huntington's was in the 50s. And
Right.
even in the 60s, when one of his daughters presented, they still weren't sure what this
Yeah.
disease was. So I kind of, I get it. I get that those people really didn't know, and so they couldn't impart that information to their children.
Right.
So just as a social worker, I mean, it's really hard for me when I see these generations who clearly know that they're at risk, they know that HD is in the family, but yet they're continuing to reproduce. That's really hard for me still, because those young people that spoke today that said, let this be the last generation of Huntington's, they have the technology now to prevent it and to not pass the gene any longer. And I just wanted to hear kind of your thoughts on how you respond to some of your clients, like this 8-month pregnant young woman. I don't know what her situation was, but how do you go about that? How do you?
Well, I'm so glad you're asking me a nice, easy question.
I'm sorry. I just, it's a huge emotional response for me, and it has been for generations now, where I see this
Yeah.
happening, and it's like, oh my
Right.
God, how could you not tell your children? How could you not know? How can you do this? So, it's just, anyway, I'll pass the mic now.
Yeah, that's right. It's a long time, well, maybe 10 or 15 years ago, I remember at convention, this topic often coming up. And when I was newer to Huntington's disease, I would sit in the audience and hear about this issue about, many people in the Huntington's community feel like they have suffered enough, right? They've had a lot of losses. They continue to have a lot of losses. How can we deny them being able to have a family, right? And that many people in the HD community continue to feel very strongly about that. And we actually had a young woman we had professional training yesterday for the social work staff or social workers around the country. And one of the young, who's all of 19, who went through gene testing, and one of our other social workers asked her about this very question. And it was very interesting to hear her response. I thought she was going to go off in a different area, but she very much was like, very supportive of that same idea that to deny people sort of the right to continue to have children, she felt very strongly that was not something that should be happening to HD families. It's a very challenging question. I know, I sit with people that are actively pregnant and symptomatic, right? As a social worker, you are sort of earning your pennies for the day on that day, really trying to, I have to deal with what's in front of me, right? And it's a hard debate within the community. I'm sorry, I'm dancing around there, but I appreciate you asking the question. Did you have a thought or a comment? Oh.
This has come up in my family a lot about my choice of having children. I was always afraid that at some point in their lifetime they would really be upset with me that I brought them into this world with this hanging over their head. Mm-hmm. And their response to me was, then that means that I don't have a right to be here.
Right. Yeah.
And my life matters, and I'm glad that I'm born into this family. And so I think when you say that, you have to think about what it feels like to hear those words, and how that would impact your self-worth.
Yeah. I appreciate you sharing that. It's a great point. Yeah.
I was just going to say the support group meeting that
Oh, can you talk into my, sorry.
in the support group
meetings that I go to in Palo Alto, California, one of the comments is that when that's brought up is that they thought that there was going to be a cure by then.
Yeah. Did everyone hear that? That they were feeling like there was going to be a cure, right? So, and one of the things I know when I first started in our program is that, and we're in a very rural upstate New York area, and I would have women who would tell me that when they were in their like mid-20s and going to see their family practice doctor over 30 years ago, and if they knew there was Huntington's in the family, and they would ask their doctor, well, should we have a family, right? We're talking about around 1980s or so, okay? And a lot of times, these are kind of rural area, family practitioners just doing the best they can would say, well, yeah, because I'm sure by the time your child is of age to have Huntington's, they're going to have an answer for it, right? And so I think that was in a good faith effort, and so most of these people went on to have children who are now then, here we are in 2018. And so, I think it's just something to be mindful of, and I think about that when we talk about what's going on with the really wonderful research and everything, to still be careful, of our words and our promises, in terms of Huntington. So, was there another comment though before? No. All right. Well, thank you all. It's 5:00. Thanks for staying. Firearm, alarm, and all. Oh, thank you.